Zealand's demographic, a large rural population, distinct ethnic groups, and an ageing population all create challenges to equitable and effective healthcare. New Zealand's population pyramid shows this. It's predicted by 2031, 20 to 22% of the population will be aged 65 or older. Comparing this to the 14% in 2011, and recognizing the rise in the likelihood of non-communicable diseases, NCDs, with age, the burden on the healthcare system becomes apparent. And New Zealand is not alone in facing the challenges brought about by a rise in non-communicable diseases due to aging populations and changing lifestyles around the world. Worldwide, in 2016 alone, 24 million people died from stroke, heart disease, or cancer, making up 42% of total deaths. The statistics speak for themselves, so much so that one of the United Nations Sustainable Development Goals is to reduce premature deaths from NCDs by a third. So how can we improve the treatment of non-communicable disease? Nanomedicine is the use of particles between 1 to 100 nanometers in size to treat disease. More specifically, it can be used for early detection and treatment of NCDs like cancer, as well as improving prognosis. Earlier diagnosis is cheaper too, with some studies suggesting it's up to 4 times cheaper to treat early-stage cancer. Let's take a specific example of how nanomedicine can help New Zealand's healthcare system, the breast cancer screening program. This map was taken from the National Screening Unit's quarterly reports to the DHBs and shows screening rates for eligible Māori women. In only 2 regions are they at the target 70%. It also highlights the trends of low screening levels for women in rural areas and in areas of high socioeconomic deprivation. These women not reached by the screening program who develop breast cancer are 3.79 times more likely to be diagnosed at an advanced stage. So what can be done to improve screening rates for these women and create a more effective system to cope with the aging population? The answer is nanomedicine. Liquid biopsies are an exciting new innovation for the early detection of cancer and work by taking a blood sample and testing for circulating tumor cells, or CTCs. Unlike mammograms, they're less intrusive, more flexible, and can be operated from most medical practices, meaning they can be adapted to work with Māori health providers. But how do liquid biopsies actually work? CTCs are present in the blood of cancer patients, but in very low volumes for early-stage cancer. Using nanomedicine, it's possible to detect CTCs in solutions of only 0.001% concentration. And there are 2 possible techniques to achieve this. Positive enrichment targets the CTCs themselves, using nanoparticles with magnetic properties to bind to the CTCs and isolate them, and then uses a magnet to separate them from other cells in the solution. Building on this, theranostic nanomedicine aims to combine diagnosis and therapy into one procedure, and so researchers have also created nanoparticles with a magnetic core and gold shell. The high photothermal properties of gold mean that when exposed to a laser, it can heat up enough to kill the cell. The second technique is negative enrichment, removing non-target cells. To do so, blood is passed through a geometrically activated surface interaction chip. This is a small chip with an asymmetrical herringbone pattern that creates turbulence in the liquid, increasing the number of cells exposed to the wall, which are coated with antibodies. These antibodies bind to white blood cells and remove them from the solution. This is assuming larger red blood cells have already been removed. The advantage of this technique is it's less specific, so it can be applied to separating CTCs from a wide range of cancers. But the simplest applications for nanomedicine are in chemotherapy. Smart nanoparticles respond to stimuli, like a change in pH or temperature. They can improve targeted drug delivery, reducing non-specific toxicity. Nanomedicine can also be used to modify the properties of drugs to improve their circular half-lives, increasing efficacy without increasing dosages. And cancer is not the only NCD that can be treated more effectively with nanomedicine. A recent study from the University of Otago predicted a 40% rise in strokes in the next decade. Nanomedicine can be used to deliver drugs to the blood-brain barrier, either helping to break down clots in ischemic strokes or help clotting of hemorrhagic strokes. In cardiovascular disease, nanomedicine can be used for a more accurate and earlier diagnosis, binding to clots or plaque and making them more visible in MRIs. There is even a current study underway that uses nanoparticles to detect the presence of MPO, an enzyme present at the onset of atherosclerosis, but before a noticeable buildup of plaque. For the 240,000 diabetics in New Zealand, nanomedicine is behind the development of controlled-release insulin, as well as the creation of synthetic islets, the cells in the pancreas that release insulin. And an aging population also means a rise in neurodegenerative disease, with 170,000 cases of dementia predicted by 2050. One of the biggest obstacles to treating neurodegenerative disease is the blood-brain barrier. This selectively permeable membrane separates the central nervous system from the rest of the circulating blood in the body, and the membrane is capable of detecting most foreign particles, including the drugs used to treat the disease. By using a variety of nanoparticles, such as liposomes, scientists have been exploring how nanoparticles can carry other drugs through to the brain and central nervous system, protecting neurons or stimulating new neuron growth for Parkinson's patients. And for Alzheimer's, it's possible to use nanoparticles to attack the buildup of A-beta plaque within the brain. So, to conclude, nanomedicine provides a novel and innovative solution to treating non-communicable diseases. It has applications in treating many diseases that are amongst New Zealand's leading causes of death. It will be able to help the healthcare system better cope with the ageing population and contribute to the United Nations Sustainable Development Goal, ensure good health, and promote well-being for all at all ages.